a family of 4. We live here in Savannah, Georgia. Have a son, Myles, 12, and Mia, 5.
About a year ago, I had some headaches going on.
Myles started having headaches about 2 days before we took him to the hospital. They were just kind of intense, and we weren't super concerned. We went to see his pediatrician. Thought maybe it was a sinus infection, went home, and when I picked up Myles from school the next day, the headache was just worse. So we kind of kept treating it, and then that evening he threw up. I said, okay, we're going to the emergency room.
The doctor told me I had some kind of white spot in my head.
You can see on this axial view, the center of his head is enhancing, and this is a tumor. He was basically diagnosed with a brain tumor on an MRI scan, and it was in the center of his brain. We call it an intraventricular tumor, and it was not on the surface, so it was hard to get to. So I studied the pictures and analyzed what I thought was best for him.
The next step was a biopsy.
I thought doing a biopsy with my neuroendoscope would be appropriate. It would be a minimally invasive procedure. We would get the answer of what the tumor is and do it relatively low risk.
We got the call from Dr. Thompson June 13th and asked us to come the next day. We went in and we probably talked to Dr. Thompson for about 30 minutes before we realized that it was cancer. I believe he said something like, well, there are trials for this high-grade glioma. There are trials. And when he said trials, I said, is this cancer? And he said, yes, it's malignant. And that was like, I mean, I don't even know what, the blood just goes to your feet. Like you just want to pass out. I mean, I don't know what else to say. Just devastated with the results. After that, we knew a week from then we were going to have the brain surgery to remove as much of the tumor as they could, if not all of it. It was left and right at the same time to get both sides, or from the top, which was actually the most dangerous because you have to go through the midline. And getting into that area could have changed Myles completely. Vision loss, hearing loss, paralyzed, stroke.
9-hour surgery. He got 75% of my tumor out of my head.
When he got out of the surgery, 9 hours later, he had gone in from the left. He got as much of the tumor as he could, went under the midline, and got a little more. When he came out, he told us that we may very well get a different diagnosis. Now that we have this huge piece of the tumor and we can get more, test results, we may get a different diagnosis. And I lived in that statement, lived in it. During the time that we were in the hospital, Dr. Pendleton came in with some nurses and asked Myles to give his tumor to science. Would he be willing to do that? Myles, sure, he thought it was cool, signed all the paperwork, never thinking that that was what was going to come into play just after surgery. So then June 21st, we have the brain surgery. Dr. Thompson sends it off. And I think some of the samples went to different places, one being to genetic mutation testing, which we would have never known anything about if it hadn't been for Cure.
Precision medicine is really the next step. Precision medicine is the idea that we would like heading towards the goal of having much less toxic but more effective therapy for all children and adolescents and young adults with cancer.
At that time, Dr. Thompson recommended we go up to Atlanta, see Dr. McDonald, and we met with Dr. McDonald on Monday, and he was so pleasant and nice. We went in and he took one look at the original pathology and said, how did they even get high-grade glioma from this? again, I just thought about what Dr. Thompson said, and that I lived in that. Like, okay. So we left there thinking, okay, we'll do whatever Dr. McDonald says. And then 2 days later, we got the pathology back. And Dr. Thompson called me. I was at work, and he said, I have relatively good news. And I said, okay. And he said, it's not high-grade glioma. It's never going to be, it's not a classified tumor. We don't know what it is. We don't know, doesn't have a name. The NTEC mutations respond to a precision drug. And the NTEC mutation is what drives this tumor to grow. And this drug stops it. He explained to me what it was. It was Vitracvi, and that it was targetable, and that in 2 months we would know if it was working.
It's just a pill. I take it twice a day, in the morning and then before I go to bed.
Had we not enrolled in the program to have the tumor genetically tested, the genetic mutation testing, had we never done that, we would have never known what this tumor was made of. We would have never known what was the driving force behind it or what options were there. We would have absolutely done the traditional approach to high-grade glioma, which is radiation.
His tumor, the last two MRI scans have stabilized, but he's not had any growth. This last image is his initial, and now here's what he has left.
I was just completely moved by the stories. It really impacted me to hear the stories. Never in a million years did I think that a year later, Cure would be coming to see me in the hospital. They're some of the most compassionate people I've ever met. To find out that Cure funded the genetic testing, I just thought it was a miracle, really, because had they not gotten involved, we would have never known about the program.
What Cure has done for Myles has really helped. If we did not have this information, he would not have gotten the targeted chemotherapy that he has received. Cure, I think, does help bridge some of those gaps. The knowledge I've gained just knowing they help this for the next kid, to help that family and help the pathologists make sure that we get the right information.
Cure childhood cancer is very helpful to my parents and I. Now it feels way better, and I feel like a normal person now. It's way better than last summer.
Seeing Myles be the kid that he can be now makes me feel amazing. And even when he's being a preteen, I have to remind myself that I might not have ever seen this, and the thing that I prayed for the most was to see him grow up. So in those moments I have to say, okay, yeah, he's a little annoying right now, but when I went to strangle him, I have to remind myself, like, this is such a blessing that we're here, because we wouldn't have been. And I'm so grateful. It makes me happy to see him grow up, get taller, talk about his tennis shoes, and ride his bike all over the island. It makes me so grateful and blessed.